Hi, I'm Dr. Marcela Torres, and I'm very excited to show you this new procedure called Sonata. Sonata is radio frequency of fibroids. In other words, Sonata is a treatment for fibroids. Fibroids are masses of muscle made from the same type of muscle that is in the uterus. Some people have symptoms of bleeding and pain with periods and pain during intercourse, and they come to me and I do an ultrasound and you can see the little round fibroids around the womb, the uterus. This device is able to have an ultrasound at the tip, and it will target your fibroids with some energy that would help the fibroids shrink, and in 3 months your fibroids are smaller and your bleeding is better. So this is how we do it. We take the device and we locate the fibroid, which is going to be inside your womb or your uterus. So as you can tell in my monitor, you're gonna find that fibroid, which in this model is right here, this circle right there. As we find this fibroid, we're able to target it with the lever. We advance it to the location. We bring a small little needle that would hit the area. We make sure that we're not burning anything else. We then move on to deploy 3 or 4 more electrodes that are gonna allow us to target the entire fibroid, and we activate the system in order to do radio frequency ablation. Radio frequency is a type of energy that's gonna allow the fibroid to shrink. It's gonna make it kind of melt, just put it that way. And that way the fibroid is going to hurt less and give you less bleeding. When the ablation is over, we proceed to remove the device from the fibroid itself, and then we remove it. The Sonata system is a very good procedure because it is an incision-free. It allows you to have outpatient surgery. You don't have to stay in the hospital, and you keep your uterus. So Sonata is considered a procedure in an outpatient surgery center. So you will come in and you will go home that same day, and you'll be able to go back to work the next day. Sonata can be done with very light sedation. If you're able, or your doctor is able to do a spinal or an epidural anesthesia, you don't have to undergo general. But if you're very scared, you could use general. The side effects of the Sonata could be initial. You can have irregular bleeding, you can have pelvic pain, but eventually it will slow down and it will go away. You will not require any medications unless you have a little bit of soreness or pain. Then I'll give you some ibuprofen. So after Sonata, you will be able to go back to having intercourse with your partner as long as you're feeling well and without too much pain or any bleeding, and that would happen pretty quickly in some of my cases. I just want to share that my last patient that I did a Sonata procedure on came to me as a post-op and told me that she had no pain and she didn't have to take any of the medication I sent you. So I was very glad and pleased, and she was very happy with the results. I'm Dr. Marcela Torres, and thank you for watching.